so that it's pretty standardized when you move around. Then as you go to the right, the columns that are going to appear are dependent on your role. So the outpatient nurse doesn't need as many things on her list, on her status board, as the nurse inside or the inpatient nurse. But this is where I'm acknowledging my orders. This is where I would have an order if there was any orders entered on this patient and I needed to collect a specimen, such as a urine, it would show up. If the patient had any orders that had been resulted, you'd see your new results in this column. And if there was meds ordered, you'd see that here. And then the detail, the secondary status board, would have queries, information that's specific to that patient population or that discipline. And once it's been documented, it will start to fill in here. And then the patient header would be the same throughout every application. You're always going to have your name, your age and sex, your birth date, the registration type. So this patient coming into triage is a registered clinic visit, and then your location. And you've already been seeing, but everywhere is prefixed with either one letter for the one of the 4 facilities or 2 letters, depending on where you are. All of the locations and the account information is going to be prefixed. So for Collingwood, that prefix is M, so I can tell that I'm at Collingwood and I'm on the location of OBS triage, I believe. Your code status, if it was ordered by the physician, would show next. If this patient had a height and weight, that would be here, as well as their BMI, and their allergies. This patient has had a previous visit because they do have no known allergies coded. Their account number, again, prefixed with M, C for clinic, or A for acute, E for emerge, and their unit number. So this patient's now here for a non-stress test. What I would do next is I have my patient on my list, the one I want, highlight it because I could have more than one, but this happens to be the first patient that's showing up today, and so it's easy. I open my chart. This patient's standard of care, the interventions that need to be done for all the patients that present is automatically loaded based on the patient being registered to that location. I can come here, and as Elaine just showed you, if you were on the previous session, you can come into the summary and you could be updating the allergies or just asking them, I see you have no known allergies. Is there any changes? No changes. So I could come in here, check them off, confirm it, and that would update the date to say that I had reviewed for this visit or put any changes in. I can flip back over to my status board or excuse me, I didn't mean to do that, sorry. I can flip back to my work list from the status board, the summary. So the next thing I need to do is document on my triage assessment. So I want to document that I did it right now. And I click document. If for some reason I am behind, I can change the time to be a little bit earlier because it will, if I click on the drop down in that green section at the top, it will give me a clock that I can change it to a little bit earlier. I can't document ahead of time, but I can document a little bit behind. The system is actually capturing the recorded date and time, which you can't change, but you can change the actual activity date and time. There is a protocol attached to this one. I can see that. I can click on it, and it's giving me the OTAS as a reference here and some on how I would calculate that information if I was further along. So from here, I'm just going to start documenting that the mom arrived today. She arrived about, let's say, 15:25. And she was accompanied by her significant other, and she came from the physician office, and she was an ambulatory patient. I'm not doing a primary assessment at this time, so I can just collapse that so it's not in my way. The same with the secondary assessment. I can just click on that. That will collapse that section. And we're not doing this. She's here for an NST, so we're going to do the electronic fetal monitoring on this mom. And you can see there's an A here that's defaulted in because we're going to do it for fetus A, the first baby. If the mom was having twins or triplets, we could add another fetus here and be able to document on many babies, as the case may be. So for baby A, the baby that this mom is carrying, we can now go ahead and document that the fetal heart rate is 130, the maternal heart rate was 80. She had some moderate variability. She did have some accelerations present, and she had no decelerations. And she had a normal NST. So from here, I can then come down to the bottom and save it and exit. And that's now showing me that it was done. It was last done 3 minutes ago. I can refresh my screen. And now I can just ask the mom to relax a bit there. And while I go off and call the obstetrician to let him or her know the results of that test. I could also go on to my next patient if I needed to while I wait for a call back or whatever has happening in that unit. And because I can click back over to status board, I can close that chart, and then the next patient that would be on my list of what I need to bring in, I could start to bring that patient in and do some documentation, and then I can go back and open the chart for this one. So I've called the obstetrician. We've talked about the results of the NST and the presentation, and the decision is to send this mom home. So since I've already documented on this assessment, I just need to go in now and document the disposition. So I can go in and I can edit now. It will bring up all of my documentation from previously, and I can just come down here and click on the edit button again. Sorry, my screen isn't big enough here. I have to keep scrolling to edit. Go into the section that I want, which is the section here that says I'm discharged home, and edit. And I can click off that I was discharged home. Collapse this section. I don't want this one again, and this one, and this one, and this one. And then tucked at the bottom is the ability to document the discharge instructions. So what kind of teaching did I do? What kind of handouts did I give this mom so that I can document against that? You can see you have your legend here that indicates what each of these columns mean. So if I did some teaching, I would check it off. So I did some teaching on active labor. I did some teaching on fetal movement counting, but I also had a handout that I gave the mom for this. So there's the RES means resources provided. And I would just go through, just like I was checking off on a paper spreadsheet, that this is what I gave them. When I'm done, then I would save and exit, and my documentation is done. Mom is out the door. My other patient for today has also been seen in the clinic today as triage. She just isn't showing up there because she has been seen, had an NST done, has had her primary assessment done. I've talked to the obstetrician, and we're going to admit this mom. So I've already gone ahead and we've communicated that decision to admit to the clerk, the birthing unit clerk, or to the registration, bed allocation, or to the switchboard, depending on which site you're at. And they have rolled that mom's account for the outpatient visit to an inpatient visit. We've got telephone orders as well for the mom. And we have new armbands and labels printed, and I've changed the armbands up. So I've got my admission armband on now. And they've also pre-registered my baby, and my medical directives are in. And we've moved the mom into the birthing unit. So she's now in the labor room, and this mom is close to delivering. So for this mom, what I want to do is when I'm sitting on this status board, and if I go to lists, I only have my PCS status boards. So if I go back to the return to over here in Expanse, it tracks what applications I have open. What am I doing? Well, right now I only have the PCS status board open or my main menu. So if I click back to my main menu, I could now go back and I can choose the specialty care desktop because now I'm in the birthing unit and I want to be documenting on the birthing record the stages of labor on my flow sheet. This mom isn't on my list. You can see I've got one patient on my list. But what I have what's different on this status board, a couple of things that are different. We have the same 5 columns, but then off to the right, it looks a little bit different in that we have precautions on here or isolation on this status board, so that if they were on any kind of droplet or respiratory enhancement, it would be there. We also have some OBS specific information here that will show me information about their labor. Then we have the same things that we saw on the outpatient tracker: acknowledge orders, when my next meds are due, new results, any uncollected specimens. But because I'm inside now, I also have some other columns that you saw previously as well for TAR. So if we had to give this mom any blood products, we would have that. We have the transfer discharge. So if there's transfer orders, when we're moving from birthing unit to postpartum, that would appear here, or when the mom needs to be discharged. If she is being discharged directly from birthing unit, didn't move to a postpartum bed, it would show up here. Otherwise, it would also show up on my PCS status board. And then you have a little bit of different information down here, some of the same information we saw in the detail or the secondary status board, but a couple of extra things in here about epidural, IVs that may be infusing, postpartum voiding, and any communication orders. Header's the same, but the other piece that's very different here is that you don't have lists over here and everything's grayed out here because you have your list here. So this bubbles up top here are going to be different depending on your access, your role. So for me, I have my list. I also have the Collingwood birthing unit for OBS. So when I select this one, it's giving me, without having to go to any location, an extra keystroke and find that location. I just click on the birthing unit and I can find all of my mums that are sitting on that birthing unit right now. So this is my mom here who we're now picking up from triage that we're going to start to go through her labor. And so what's different here is I would just have her highlighted and I can add her to my list here, or I could just open her chart and continue on. But to get her on my list, I would do it that way. You also have the nursery if we have babies that we wanted to do any documentation on while we're on the specialty care desktop, or you can also do them on the PCS status board. You have any location. At the moment, we only have the inpatient locations attached for Collingwood, but we could change this so that we had both inpatient and outpatient. I have recently accessed. The one that you're missing here is the that you saw, and our other one is the any account. The challenge we have here is we can only have 5 across the top here. So we would have to take one of these away. So we'll have to have some discussions with the different working groups, especially for areas that we have more than one location that they can click on. What other ones we want to have here? Probably in this case, we might want to have any location and find account then. But that's why we only have 5. If you pick anybody from any location, so if, say, I had another one for OBS, and I pick a patient, it will automatically add a 5th one over here. So back on my list, here's my mom. I'm going to highlight my mom. And what's different here is opening the chart. You only have one option. You only have the clipboard in this first column because you don't get any options over here on your right side menu until you've opened the chart. You can also see that she has a few things that have been happening with her. Oops, sorry, go back to here. You can see that based on what information was documented in triage already, She's a gravida 1 and a para 2. She has had her group B screening and it's negative, and that's the only information we have right now. She also has orders because, I said, she has orders that have been entered because we've already talked to the physician. So when I click on the orders, you can see that she's had the birthing unit admission order set added, which gives her a bunch of orders here for this fetal surveillance, her resuscitation status, some blood work, an IV, a protocol diet. So I've reviewed all of those. I can acknowledge and save. Return to my status board, and that will go away now. So let's open this mom's chart. Maybe. It defaults to the work list at the moment, but we could have that a little different if you want when you're working on the specialty care desktop to default to the flow sheet. The challenge here, I think, is going to be that for some of the moms that are admitted, you may be doing some of the admission assessment right at the beginning. And for others, you're going to be popping right into the LD flow sheet because they're in active labor and you don't have time to do that history. It has loaded some of my OB standard of care based on the location as well. So you can see that I have some things that were added on just as A's because they came in as the standard of care, and some that came in as AO, meaning it came in from a physician order. So there's an order for an IV. So that flowed over. There was the order for routine as per protocol, fetal health surveillance. And there was the order for a diet protocol. Everything else was added in based on the standard of care. So if I had time for this mom, then I could do the admission assessment. If not, I can just go to the LD flow sheet because this mom is in active labor and begin to document on her from the flow sheet. So this is the part that is very new with Expanse, the functionality to be able to have a flow sheet where you can document and view at the same time and keep it open as you need to. You can also flip around and document on your meds, your vital signs, all of those frequent things you need to do here right from the flow sheet. But you also have the work list and your EMR right at your fingertips here to click on and see what's going on as well if need be. So for this first part then, let's start to go through. What we'd be doing here is starting to document on stage 1 and the uterine activity. So I have drop downs for all of these. I could click on the drop down and you can see it's giving me a keypad, which tells me that this is a number. So I can type the number in here, or I could just go in here and type in a number. So let's say that she has 3 contractions in 3 minutes. The duration is in seconds. Oops, oh, sorry, I skipped a line by the looks of it here. It's a comment that I can just fill in about the duration, or I could type in a number there because it is a comment. So at the beginning, as you get used to the flow sheet, just as you get used to all of the other items, you don't see the drop downs here without clicking on them. So it does take a little bit of time to get used to it. But once you know what's there, then we can just start to type in the information. The intensity, I have choices here. I have a checkbox which tells me that I can document more than one answer. So I could say that there was cramping and it was a mild intensity. Palpate it. I don't have any checkboxes here. So in this case, all I can check is one answer here. It's not a multiple choice, so I can only pick one. The same with my uterine resting tone. One choice only. And I would just go through and document. I'm not going to document on every single one. My background is not OBS. Everything I've learned about OBS is from informatics. So we've done that part of the uterine activity. I can collapse this part next because I don't have a monitor information, and I can start to document on my auscultation here. Then I can just scroll to get this more in up. Again, just like we saw on the NST, the baby A is there, and if there's more than one baby, I would just be able to choose a baby B, C, D. I think we have about a dozen babies we can have at this point to document on. So my fetal heart rate, again, it's a drop down. If I don't know what's there, it's a keypad. It's telling me what the average range is here. Or I can just type in that my fetal heart rate was 130. My maternal heart rate was 80. My rhythm, it's regular or irregular, or if I know that, I can just type in the R and it will take that, just like you would be seeing in some of the other assessments if you're in flow sheet mode in the PCS assessments. They have accelerations. They don't have any, mom doesn't have any decelerations. I don't want the electronic fetal monitoring, so I can just collapse that and I can come and document on my dilatation. So again, it's a keypad, so I can type it in from there, or I can just type it in here. Let's say she's 8 centimeters, she's getting there. Basement, position, let's say anterior. Quality is firm. My fetal station, I don't know. These ones, don't remember those. Skip over that one. My presentation, I don't know yet. And I don't know my position of the baby yet. Okay, and I can, something's happening, I can go, sorry, I have to keep scrolling. I can save this now and still keep that open and just continue on to now I could go down to the membrane section. You can see now that I have columns here with previous information. I can collapse, open things up as need be. If I wanted to see as well what happened, I'm not sure what, must have been earlier, what was it? Wait a minute, just a second here. Oh, so it did it so long ago. That wouldn't, so it was 12:30. In real life, I wouldn't have done the NST at 12:30. I don't think, and then be documenting. We'll get this far, but you can scroll backwards to be able to see what happened at triage or as you go through the labor. And then I just move my scroll bar over here again to the end, and it will pick up where I left off. So if you've got a lengthy labor happening here, you're able to, come on, move over here. Scroll back and forth if you needed to be able to trend what's going on with that mom and see, or if you were wanting to, if you were coming on and wanting to see that trending because you hadn't been there. I can also change my window so that I could get a shorter time slice here then if I wanted to see it over an extended time. So let's say 3 hours. So now I'm able to see how she presented at triage. I can see how she presented when we started, when she moved into the birthing unit, and then I can continue on with my now columns here now. You also have lots of flexibility when you right click into this column to add a column, edit the time here, make some changes as need be to add in a column at any point in time to document. So let's collapse that because we're not there on that one right now. Let's come down and say that she had a spontaneous rupture of her membranes. They ruptured today, And they ruptured at, let's say, 3:30. I'm going to do an automatic calculation for you here then of the time and count, but that will continue to count. Her amniotic fluid was moderate. The appearance was meconium stained, or it's multiple. I could choose more than one. She didn't have any vaginal bleeding, so that's all I needed for that part. So she's continuing on with her labor, but it's progressing quite quickly now. Oh, and she also had a pain score, only 5. She's doing pretty well, good, and isn't going to have an epidural. If she was, then we would have a section for anesthesia here to be able to document all of that. The time they were requested, when they came, when we did the procedure, what was happening. And then you would also have available further up here on your MAR, you'd be able to go in and start that epidural and document the titration here for any of the meds you're giving. Or if you're getting mag sulfate, that you'd have that on your MAR and you would be able to titrate from here. Very similar to how Amy was showing yesterday, if anyone saw the EMAR. It's just that we don't have to click into the infusion titrate. On the EMAR, we have the infusion titrate right here so that it would show any medications if they were there, and I could just flip back and forth here on the flow sheet. So mom's getting ready, labor's been progressing. Let's see, my cervix is probably fully dilated now, and so I'm going to come down to the pushing section and indicate that it's fully dilated. It's the same day. It happened, let me say, 15:45. It's again going to capture the automatic time here elapsed. When did I start pushing? It was today, because again, remember that it might be after midnight when my labor first started. What time did I start pushing? Again, it's capturing the elapsed time. What type of pushing was it? It was directive and it was effective. And the baby's popped out. So the baby was born today and the baby was just born now. So my N works just like it does in your current state, and I can save. So that's my stage 1 and 2. Baby's been born. So at the same time now as the baby being born, I'd be collecting those cord blood gases, labeling them, sending them off to the lab, communicating out to the clerk or the registration switchboard to admit that baby, because that baby's been pre-registered and is sitting there, and telling them the gender of the baby so that they can complete that registration. Simultaneously, we'd be finishing off on this mom. So for today, I'm going to flip into stage 3 next then, and the placenta has been delivered. So again, it's my calendar, or it's T for today, like we're used to. The same, it's the time clock if I click on the time clock, or it's N for now, or it's the actual time. The placenta delivery was a spontaneous delivery. I could have multiples here though, because it's sort of available. And my disposition, it was just a routine. Again, I can save that at any moment in time, and my flow sheet's still open. I can see what's going on and continue up. Maybe I had to do something again with my MAR, my infusion. Vital signs, I can come in here at any point in time, do some vitals at the same time as well. And once I know what's in here, I don't always have to do my drop down. It's going to flag the same as it does on all of the other activities. If it's abnormal, it's going to flag it in yellow. I don't know this one off the top of my head because there's a bunch of them here. So she doesn't have any oxygen. Then I can just collapse that again and come back down here. So I've done my stage 3, and then lastly, again, simultaneously, all of this would be happening. I'm also going to be documenting on the baby, but for now I'm documenting on the mom only. So I'm doing my stage 4. She's 3 centimeters above the umbilicus. Midline is midline. My fundus is firm. I didn't do any massage. I didn't have an episiotomy. I did have a little bit of a tear though, but no sutures. So I can just do the N for that. My look up my perium condition. Again, I got multiples to choose here, but let's say that this mom is doing well and it's approximated as we would expect. Pericare, we had an ice pack applied. The care was done by the nurse, or you could free text in if something else was there, not in the lookup. And I have a little bit of, everything's normal here. Amount, just a small amount right now. I don't have any clots. To void. Yes. I was actually able to void post-delivery. I did my early attachment, skin to skin, and I've positioned for breastfeeding. And the baby actually has been able to latch, and they're sucking, swallowing, so we're doing well. And I can save. So that's my mom. I've done my delivery if I needed to, because we had an epidural. We'd also have that there, your IVs, things that you would need to document on are on this flow sheet for you to document on. So now we still have to document on the newborn before we are transferring to postpartum for that birth activity. I can go back to my patient list. I could go to next patient on my list because I may have another patient and open that chart. It just depends who the next person. I only had 2 on my list. I don't have the baby on my list. So what I'm going to do is go back to my patient list, back to my mom. And I'm going to go over here. And I do have my PCS status board. So I can go back here. And I can just go here. Because my mom is on the unit, or she should be. Let me go to my list. Okay, a little bit of a glitchy here. Let's go back here. Just go here. Okay, she was there. And the baby was linked. Okay, let's go to.
Carol, it's just a time check. It's almost 4 o'clock.
Yeah, okay. Yeah, the baby, I'm not sure why I'm not seeing my baby. Only thing I just want, oh, there we go. I'll have to add her on manually here. Not quite sure. She was on my list. And I should be able to see her from the mummy's chart. So for the baby, the only thing we'd be doing here then is coming into our work list, adding the baby standard of care. And then I'd be able to document on the birth information while I'm still in the birthing unit. Then we'd be transferring out to postpartum and picking up on the postpartum. And when I'm on here and I have my mom up, I should see my link and it just doesn't seem to be working right at the moment. I should see the mom on this location, and I should see a baby carriage under this link to show me, and that's how I would get to the baby. And it was working just before the demo, so I'm not quite sure what's not right on this unit right at the moment.
Gremlins, Karen.
The gremlin, yeah, the gremlin. Okay, so that's a quick overview of what happens in that very busy birthing unit world. Do we have questions?
There's no questions in the chat at the moment. Does anybody on the call have any questions for Carol?
Connie is on as well.
And I've put the link to the survey in the chat. So if anybody thinks of questions later, or is just trying to figure out how to word it right now, or it's a bit more in depth, please just fill out the survey and we can get back to you as well.
Okay. Thanks, Carol. That was wonderful.
It was very well done. Thank you, Carol.
Okay, just the one little gremlin. Why you don't see the link?
I think I see one that's just popped up in the chat.
Yeah, we got another minute. We're actually on time today.
So yes, Corinne, typically, and this is where our gremlin comes in, we would actually see a link right by the mom's name that would take us to baby.
Here, let me see if I can do it from another. I'm not sure why. It was definitely working because I had Shannon in the background helping because somebody had documented on my mom from yesterday, and so I had to have her undo and redo and then link the baby again, and the baby was definitely there.
So in the chat, Shannon has said you don't have well, you have a gremlin, but not a system gremlin. Somebody transferred your patient to the OR.
Oh, that's why. Okay, that's why. So that's the only trouble about these demos is that all these patients are available. So I have my mom set up for yesterday, and then today when I went in, there was documentation on my mom, so we had to redo.
So Carol, the RVH moms got the link showing on them. If you look in the RVH site for some PCS, just to show the link.
No, you'll have to change subdivision.
Oh yeah, right.
Right, sorry.
I'm going to transfer it back for you, Carol.
Corinne, yes, she's just going to show you that. There is a question regarding midwifery patient. So the midwives will be entering orders and documentation as well. And they have a foot in both worlds. There is documentation in PCF that they will need to do because of the need to submit born data. They will have, they'll be in PAPD-OM for part of their work, and then they'll be in PCS for some of their other work.
Shannon just said she put the mom back in OBS.
Thank you, Shannon.
I have to switch back again, then just give me a second here. Back to.
I was thinking myself, where did I do that wrong? No, I know I put it to OBS.
No, and she was there. It was just. Okay, so now I'll go down to here. There we go. So here's my demo mom.
Yay.
And here's the baby link. And you can see that demo mom now has a lot more information in my detail section because we've had the delivery, so you can see all the information there. And when I click on the baby, here's my baby. I can have two of them at the same time. I can open the chart from here and do my work just like I was doing there. When I flip back to my status board, then I have the two of them together so that I can be documenting on both of them at the same time here now because they're linked. So as long as, and then I just return, if you don't see that baby carriage link, then there's something not right in the background, which shouldn't be the case in real life, because we shouldn't have people transferring them to the OR or moving them out or discharging or whatever they're doing when we're in a test system. Was there another
Someone
question?
stole your baby.
No, I am not seeing any other questions in the chat. Does anybody have another question?
Hey, this mom had this baby pretty fast. I think she needs to rest now.
Yep, it was pretty fast labor. It's like that blood infusing very quickly.
I think Matt Child would tell you that happens sometimes.
Yep, well, she came in and popped it quite quickly.
There you go.
Well, that concludes demo day. Good job, ladies.
Great, thanks
Yeah,
everyone for.
Yeah, I think I would like to thank everybody who's been involved in demo days. I know that everybody's been working very diligently to prep everything so that we can show our community partners as to what's coming with Expanse. So I think from all of the stream leads, as well as Dave and Christopher, we thank you very kindly. And again, thank you for all of your hard work and dedication.
All right, thanks everybody. Have a great evening.
Yep, have a great evening, everyone. Bye.
Bye.
Take care.
I know.
Thank you.